This event really bridged interprofessional communication. I learned from watching EMS assessment and their approach to the situation, and communication is key. Simulated events included a trauma assessment, an EMS handoff of care to PAs at the patient bedside, and watching a video created by GFAC and Westchester faculty highlighting a patient scenario with a bad outcome. Then we had a facilitated discussion with participants to understand what could have been done better. In conclusion, the funds provided to our simulation from the Westchester University College of Health Sciences Community Engagement Grant were able to not only foster our relationship with GFAC, but help strengthen the need for and importance of interprofessional education and communication.
Since the inception of Mindful Painting at the Center for Contemplative Studies in the spring of 2023, over 180 WCU students, faculty, and staff have had the pleasure of partaking in the painting activities. This grant allowed me to engage the community by bringing in our first pop-up artist, Alexis Bocelli, a WCU alumna from the art department, and Alexis walked us through how to paint a serene landscape. This grant allowed me to bring in a second community artist, a WCU alumna as well, Rachel Siebalist, and she walked us through mark making with untraditional items such as forks and utensils and yogurt cups, and a great time was had by everyone.
Hello, my name is Noor Buhari. I'm currently an undergraduate student at Westchester University studying literature. I wanted to talk about how beneficial mindful painting has been to me and for other students on campus. I think it's good to have a place for students to express themselves creatively and also let go of a lot of the stress that comes with university life. And from the perspective of somebody who used to work with a lot of students, I think it's only beneficial.
We provided an overview of the social determinants of health framework to 32 staff members. Then we provided 2 member vignettes, followed by this question. If we knew more about this person's situation, how could we have served them better? This session was highly interactive, and staff exclaimed how much they enjoyed this training opportunity. In the feedback form, one participant wrote, "This will help me serve as a more impactful leader to deliver our mission in support of our community."
So at the end of the 4 weeks, we surveyed participants, and we found that 50% ate more protein at breakfast as a result of our program. 78% of participants said they would eat more protein throughout the day as a result of the program. And 43% of participants said they tried some of the recipes we introduced. And they noted they tried the tofu scramble at home, also the Greek yogurt parfait, as well as the energy balls.
Nursing Knitting Club. It was like the Global Tiny Hats for Tiny Babies program. The Nursing Knitting Club at Westchester University is offering the Nurse Family Partnership nurses the opportunity to offer a baby hat as a present and potential learning opportunity to new moms in lower income and vulnerable populations of Chester County.
Our objectives include measure the potential positive effects of knitting sessions with undergraduate nursing students using the GAD-7 survey. Teach knitting skills that can be used for life as a therapeutic strategy for mental health wellness. Freshman, sophomore, junior, and senior nursing students meeting together as part of the knitting club for a common goal while experiencing social interaction.
The students stated that in the qualitative results, they really highlighted in here how the stitching itself helped them to relax. It eliminated the anxious thoughts that they would get in their minds.
I'm deeply grateful to Dean Scott Heinrichs, Associate Dean Gunter, and the Global Initiatives Committee for supporting me with the CHS Global Initiatives Award. Students returned with enhanced appreciation and understanding of knowledge and skills required to effectively serve the needs of bilingual, bicultural clients.
I'm grateful to Dr. Patricia Stacey Washington, Director of the program, and representatives of Universidad Santa Paula for a greatly enriching experience. All stakeholders benefit from such excellent opportunities. This program benefits our students through the development of new knowledge and skills through interacting with clients in a different language, in a different cultural setting. They understood the specific needs of their clients and the importance of involving their families in management of various conditions. The collaboration between our students and USP students benefited the clients by bringing the practices from two different disciplinary cultures to provide the best care.
My research project is assessing patient satisfaction with the quality of care that is provided under the National Health Insurance Scheme in Nigeria. I've been able to use these funds to recruit data collectors as well as a project consultant. This has been very helpful because I have been unable to travel to Nigeria to do the data collection myself. So I want to use this opportunity to thank the Dean and everybody in the Dean's office for making these funds available, for providing me the opportunity to carry out this research. Thank you.
This study is exploratory, and the focus is on international medical graduates who are continuing their training in the United States as interns and residents, essentially through qualitative interviews and focus groups with the interns and residents and with graduate medical education directors. We want to identify gaps in their knowledge about the U.S. healthcare system.
And today we would like to profess our profound gratitude to the College of Health Sciences for the Faculty Student Research Award to carry out our project, Rallying WCU Rams, a unique way to interact with food labels. With this grant, a 2-session study was conducted over a course of 2 weeks to guide college students to make healthful food and beverage choices and help provide an easy path for them to compare products through the utilization of a food label reading tool based on percent daily values. We were also able to present this information to nutrition professionals at the Pennsylvania Academy of Nutrition and Dietetics annual meeting and exhibition, as well as at the Delaware Academy of Nutrition and Dietetics annual conference. With the generous help of this grant, we were able to purchase the necessary printed materials for both the study and the conference presentations, gift cards for the Westchester University student participants in the study, and for 10 lucky Panned AME presentation attendees, and we were able to print a professional poster on our food label study. All of this was possible with your help. Thank you once again for your trust and generosity. Together, we can help make a difference in the community.
Thank you.
Thank you.
So Jeannie Subak and I received the Faculty Student Research Award. And what we're doing is to look at the quality of meals that are donated to the Safe Harbor shelter that's located in the borough of Westchester. And you can see that Safe Harbor is a nonprofit who work with homeless people and offer housing and meals and essential services to help individuals transition out of homelessness.
This project involved students from the Physician Associate Department, the Nursing Department, and the Respiratory Therapy Department. Our goals involved having an interdisciplinary approach to looking at best practices to cope with incivil behaviors that our students will be facing in the healthcare setting.
My name is Danielle Yoakum. I'm with the Department of Nursing. We as a team collaborated to prepare the students for this experience. We decided to use a TED Talk video, which focused on when rudeness in teams turns deadly. After this portion of the video, there was a brief PowerPoint presentation in order to prepare students for how to react to incivil behaviors in the healthcare setting. And then the students were able to complete the questionnaire that Pat mentioned.
They ultimately had to work together to not only assess the patient, ultimately decide to put them on oxygen therapy, but eventually learn how to work together to de-escalate a very tense situation involving the family member that wasn't happy with the care that their family member was receiving.
Students did seem to appreciate this opportunity to deal with this type of a situation in the very safe setting of the ILC. So students were able to navigate through this process, talk about sort of what they experienced, and then re-strategize if they weren't happy with some of their interventions.
Overview of this project. First, the purpose here was to use simulation mannequins to teach safe and effective reduction of joint dislocations. So we were able to purchase these joint dislocation simulator models that you see pictured here, specifically the finger model, which demonstrates dislocation of the proximal interphalangeal joint of the middle finger. We're also using a shoulder dislocation model that was purchased last year in our research that we're conducting. The participants for this project will be athletic training students and physician assistant students. And the outcomes that we're going to measure include confidence, perceived competence, and actual observed competence in joint reduction skills. So we'll have the students complete a lesson on reducing shoulder and finger dislocations, and then they will demonstrate those skills.